Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Pandika Purnamarza, NPM H1A020039. And I'm here to do a presentation about list therapy for a non-surgical method of flap salvaging after a free flap transfer. The aim of this study is to find out how list therapy can be applied in vein congestion or venous compromise after free flap transfer. We'll start at the introduction. Flap is one of the armamentarium for a plastic surgeon. Nowadays, for a better outcome functionally and aesthetically, plastic surgeons could use reconstruction elevator which give free flap transfer as an option. Since the technique for elevating and anastomosing a free flap requires complex procedure and equipment, it gives a lot of opportunity to induce falling flap. The falling flap is caused by vascular compromise, arterial and venous. The difference of both complications could be detected in intensive post-operative monitoring by inspection, palpation, and auscultation of blood flow using handheld Doppler. Even if it not stated specifically, detect the blood flow in anastomosed artery. Arterial compromise will show a pale less tone called slow capillary refilling time flap and negative stretch test. These complications should be treated surgically to restore the arterial blood flow. 3 hours after lost arterial blood flow, still maintain the tissue without necrotizing the muscle. It is different from venous compromise, which can cause irreversible damage and lately induce arterial com- and lately induce arterial compromise. This flap will show bluish or purplish color, high tone, and warm flap. In 8 hours, the flap will venous obstruction will cause total necrosis tissue. The flap with venous obstruction should be treated in the first 3 hours before the permanent compromise. For those threats, there are two options of management in salvaging flap before it turns into non-vital flap: surgical and non-surgical method. Even the surgical method could show visually where is the main problem of the transferred flap. For few conditions, less invasive treatment is preferable for less disadvantages and damage of the flap. This therapy, as a non-surgical method, has been accepted into clinical application to salvage a flap with vein congestion. Leeches have 700 species with genus named Hirudo. Species that is used in medicine is Hirudo medicinalis. Other names for this species come from Anglo-Saxon isleis, which means physician. Leech therapy is also hirudotherapy. The earliest use of leech is in Egypt in 5576 to 5308 before Christ, and became more popular in medieval periods until 19th century. Avicenna in Canon of Medicine introduced leech therapy in 1020. Abdel Latif al-Baghdadi in 12th century stated that leeches therapy helped to promote cleaning tissue after surgery. The popularity of leeches in medicine decreased in late 19th and not well discussed in the first 75 years of 20th century. Leeches are hermaphrodite, have 2.5 to 5 centimeter length. They have two suckers both in the end of their body. The sizes are different. The bigger one is the caudal and they use it for crawling and attaching. No jaw is on the caudal sucker so that no secretion of anticoagulant or antiplatelet aggregation come from the caudal side. The cephalic sucker is the smaller one. It has three jaws that contains of 60 to 100 teeth, which will make Y-shaped bite of Mercedes-Benz logo. The saliva consists of 12 biologically and pharmacologically active substances, which has effects such as anticoagulant and antiplatelet aggregation, vasodilator, increasing tissue permeability, local anesthetic, increasing intestinal viscosity and antibiotic action, and anti-inflammatory. The amount of passive blood loss after leech detection is greater than 10 times ingested blood. The combination of sucked blood and passive blood loss will decrease venous congestion. Few studies were reported in terms of lithography, such as after penile replantation in lingual trauma that caused massive hematoma. After replantation of amputated facial tissues, the replantation of the fingertip in sublingual hematoma, macroglossia, and ischemic finger. Next, we'll talk about the methods. A female patient, 24 years old, had enlarging mass on her jaw about 3 years ago. She underwent a surgery to remove the mass and reconstruct the jaw using a plate and a screw a year ago. 3 months later, the plate extruded and the patient underwent another reconstruction to cover the plate using surrounding soft tissue. This complex recurred 3 months after the surgery and the plate extruded on the central and left lateral segment based on the Dewar classification. The patient was referred to Dr. Sipto Mangunkusumo National Hospital to get a proper option of management, which is a free fibular flap as an option to replace her mandible. Due to the lack of soft tissue and skin in outer lining to cover the plate of bone fibula and to avoid recurrence, it is decided to put skin pedal as outer lining, so that we choose the left fibular. The surgery finished in 12 hours that anatomized one artery and two veins. Flap condition was good in immediate post-operative condition. 24, 24 hours after the ischemic time, the color of distal part of the skin pedal started to change into bluish. The sketches was positive, although the blood color is nearly dark red. It means that the arterial flow of this flap was good, but the venous flow was not adequate, even it has to vein for blood drainage. We managed this complication using Leech therapy for after 16 hours of the first assessment of vein congestion. The Leech therapy was done for 8 days with gradual decrement of frequency. The details of the treatment is described in the next section. The weight was converted to volume by using a formula. Blood cells density is 1.125 gram per milliliter. Uh, First, we put the 38 leeches during this therapy. The ablation was 4 times and decreased gradually until 2 times before we decide to stop the therapy on the 8th day. Before attached onto the skin pedal, we measure the weight of the leech and measure it again after it detected spontaneously. The weight was converted to volume, and then we gave the patient prophylaxis antibiotic during the therapy. The leech sucked 58.21 milliliter of total blood during the therapy, or 2.85 milliliter for each leech. On the last day of therapy, we checked if there was any infection of bacteremia. The final result is fetal fibular flap with partial necrosis distal part of skin pedal, which had been corrected using local skin flap 2 weeks after the leech therapy. Uh, the study is done to answer the clinical question of what it is to do based in strong evidence and explanation in using leech therapy and clinical application for salvaging a free flap on venous congestion status. How many times do leech therapy in a day? How long the therapy should be? How much the sucked blood for each blood? What is the advantage of and disadvantage of this therapy? Is there any precaution that should be noted in leech therapy? And next we'll talk about the decision of this research. Lithography is an alternative conservative method for salvaging a flap without any secondary invasive and complex procedure. It gives advantage and disadvantage that should be considered both with the clinical circumstance and post-operative monitoring result. It can be used in reconstructive planning in plastic surgery, both in off application of lithography uh, or in case of trauma cases. The longest day of application is 10 days, despite it could be stopped after 3 days. In this term, clinical judgment is needed in recognizing the revascularized flap that is no need for further literacy. Based on this study, we recommend the use of literacy 2 to 4 times in a day until the venous condition could be treated. Broad, broad spectrum prophylaxis antibiotics should be used during the therapy. There is third generation of cephalosporin, aminoglycoside, or quinolone. The leeches should be put on the part that is more threatening of congestion, and watchful waiting during the therapy is needed, considering the patient's psychological aspect and avoid the misplaced leeches. And the conclusion of this research is the actor tried to develop artificial substance that could be used in salvaging flap, what we did in Leech saliva, so that the surgeon or physician do not have to use leeches as a therapy, due to its disadvantage such as threatening for psychological aspect cannot be specifically controlled to salvage any of the part of the flap. The uncommon preparation in medicine, innovation in terms of application. Further study is needed to give strong evidence and explanation in using this method in clinical application. I think that's all in my presentation. Thank you for watching. Have a nice day, and I end with wassalamualaikum warahmatullahi wabarakatuh.